I'm Valerie Lynn, and welcome to Oncology Podcasting News. This week's OPN news includes: a hair loss drug may help detect aggressive prostate tumors earlier, a possible link between heart disease and colon cancer, and a less invasive approach for early prostate cancer patients. Finasteride, a hair loss drug popularly marketed as Proscar and Propecia, among others, can reduce the risk of prostate cancer by 25%. However, researchers noted that the men who did develop prostate cancer were more likely to have aggressive tumors. Recently, 2 studies published in the Journal of the National Cancer Institute have shown that the drug probably does not cause the aggressive tumors, but it appears to keep the size of the prostate gland small, making it easier to find them. According to the American Cancer Society, an estimated 219,000 men will be diagnosed with cancer of the prostate in 2007, and 27,000 will die from the disease. A report in the Journal of the American Medical Association suggested that there might be an association between heart disease, the single leading cause of death, and colon cancer, the second most common cancer in the United States. The study evaluated 600 patients confirmed the association. Several risk factors, such as smoking, a high-fat diet, obesity, diabetes, high blood pressure, and a sedentary lifestyle, are common to both diseases. In the study, 34% of patients with coronary artery disease had colon cancer, while only 20% of patients who were free of heart disease had the cancer. Scientists thought that both colorectal cancers and coronary artery disease develop through chronic inflammation, which leads to tissue damage. A report in the medical journal Cancer suggested that removing just the part of the prostate that is cancerous might be an effective and less invasive approach in early prostate cancer that is confined to the prostate. The treatment, called focal ablative therapy, may become similar to a breast-conserving lumpectomy in women with breast cancer. Researchers examined the tissue samples from the prostate removed from 1,184 men with prostate cancer that were confined to the prostate and hadn't spread to other parts of the body. They found that in over 19%, the cancer was completely confined to one side of the prostate gland, and over 72% had minimal tumor involvement of 5% or less. Researchers found that only 14 cases, or 6.2%, had involvement of more than 15% of the gland. Sparing the non-cancerous side of the prostate gland may preserve patients' quality of life, such as erectile and sexual function and urinary continence in men receiving the treatment for prostate cancer. Thanks for watching OPN News. I'm Valerie Lynn.